Hello everyone, my name is Mazen Saber, and today I would like to present my Project 1B assignment titled Looking at Insomnia in a New Way. Introduction. What is insomnia? Insomnia is a sleep disorder that is characterized by difficulty of falling asleep or difficulty of remaining asleep for the normal period of time. Why is it a disorder? Because it's a condition with negative impacts on the sleep pattern of a person, which means the consequences of insomnia are not biologically normal, and they are considered to be some kind of pathological response. Causes. The article talked a lot about the potential causes that might lead someone to suffer from insomnia. I've highlighted the most important ones in this slide: stress and anxiety, mental health conditions, poor routine of sleep, anger, personality traits, and emotions. Subtypes of insomnia and why. According to the National Institute of Health, almost 10% of the population is affected due to insomnia. A brain scan was conducted as an attempt to find biomarkers. Biomarkers are molecules or genes by which certain disorder or diseases can be identified. Those brain scans were very important because they showed a lot of variation in the results. What does this variation exactly mean? It means that treatment varies despite of having same symptoms, which means same people or same patients who are suffering from the same disorder, in our case insomnia, and who have the same symptoms, they might require different treatment to cure from the disorder. This is very important because it introduced the idea of possibly having subtypes of the disorder. In order to study those subtypes, a survey was conducted on a sample of 4,000 people. Those 4,000 people, they were selected based on specific criteria, such as bad sleeping habit, difficulty to fall asleep, and etc., etc. Among of those 4,000 people, 2,000 of them were found to actually suffer from insomnia. The study subtypes of insomnia. The study classified insomnia in 5 different subtypes. They are ranked from type 1 to type 5. Type 1 is the most severe one, and it is described as the following: tendency to have a low level of happiness and high level of adverse emotions like worry and anxiety. Type 5 is described as the following: patient not affected by tense life events, and they have low level of distress. In order to confirm those results, the study was done again 5 years later, and the same results were found. Personalized treatment. Benzodiazepine is effective for the sleeping pattern of type 2 and 4, but not type 3. Conjunctive behavior therapy is successful for people with type 2, but not type 4. Findings. Some sleep doctors disagree with the findings. Those sleep doctors criticized this study, and they argued that those findings are based on factors that do not really affect the sleep. The partitions doctors also argued that it will be better to have a sample where all the people are actually diagnosed of insomnia. Conclusion. Just to sum it up, insomnia is a sleep disorder that is common in the society. This study was very important because it introduced the idea of having possible 5 subtypes of insomnia. The study is also very important because it introduced the idea that the same treatment is not unified across all the patients who suffer from insomnia. This is my references, and thank you very much for watching.